Hey everyone, and welcome. Today, we're going to talk about something that's really shaking up the world of medicine: telehealth. Now, I know it's not a brand new concept, but wow, its importance has just exploded lately, right? It's become a normal part of life for so many people. It's all about bringing healthcare right to you, wherever you happen to be. So, let's jump right. You know the feeling. We've all been there. You need to see a doctor, but the idea of taking time off, the traffic, sitting in a waiting room, it's just a lot. But what if you could just skip all of that for the routine stuff? Well, that is exactly the problem telehealth is here to solve. It's really stepped up as this amazing modern answer for all those non-emergency check-ins that are still super important for keeping us healthy. Okay, so let's get down to basics. What is telehealth, really? Well, when you boil it down, it's about one simple thing: making your doctor accessible from, well, pretty much anywhere. The idea is actually really simple, but it's also incredibly powerful. Telehealth uses the tech you're already using every day, your phone, your laptop, to connect you directly with a doctor. You can get consultations, health advice, even prescriptions, all through a totally secure video or phone call. It's basically healthcare that works on your schedule. Right, that's the million-dollar question, isn't it? It's not for absolutely everything, of course, but you'd probably be surprised by how much you can actually do with it. Let's take a look at some of the most common reasons people use it. And this list gives you a really good idea of the range we're talking about. It's perfect for those minor things, like a cold or a sore throat. It's a lifesaver for getting simple medication refills. And it's so important for those regular follow-ups if you're managing a chronic condition. You can even use it for things like nutrition advice or just to go over your recent lab results without having to make a whole trip to the clinic. So knowing when to book a virtual visit versus when you really need to go in person is super important. It's all about making the right call for your health in that specific moment. This chart breaks it down so clearly. You can see on the left, telehealth is awesome for all that routine stuff: follow-ups, medication renewals, reviewing results. But on the right, for anything urgent that needs a physical, hands-on exam or maybe a complex new diagnosis, you've got to go in. The real takeaway here is just knowing you have different tools and picking the right one for the job. And think about these situations right here. I mean, if you just can't get to the clinic for whatever reason, or if you live way out in the country, telehealth is a game changer. It's also fantastic for just staying connected with your doctor between those bigger in-person appointments. It really fills in the gaps. Okay, so you've decided a virtual visit is the way to go. What happens then? Let's walk through what it's actually like, because it's designed to be super simple and, most importantly, secure. The whole process is incredibly straightforward. First, you just book a time slot that works for you. Then, you have your secure call with the doctor from home. After that, any prescriptions or lab orders are zapped over to you electronically. It's this seamless little loop that even helps you book your next appointment, making the whole thing just easy. So, now that we know what it is and how it all works, let's just nail down the most important things to remember, the real core benefits that make this whole thing so exciting. First off, speed. A typical consultation is just 15 to 20 minutes long. Think about that for a second. You get focused, direct medical advice without all the time spent traveling or waiting around. It's healthcare that actually respects your time. And this, right here, might be the most critical point of all. Just because it's convenient doesn't mean you're sacrificing quality. The whole goal of a good telehealth service is to give you the exact same high standard of care you'd get in person, always focusing on safety, clear communication, and making you feel comfortable. And really, it all comes down to these three pillars. Number one, it has to be secure. Your privacy is non-negotiable. Number two, high-quality care. You need to know you're talking to a licensed doctor you can trust. And number three, it's got to be convenient. It has to actually work for your life. When you get all three of those right, you have something really special. So that leaves us with a pretty big question to think about, doesn't it? As technology gets more and more woven into our daily lives, is this kind of easy-to-access, patient-first healthcare becoming the new normal we should all start to expect? It's definitely something to think about. Thanks for tuning into this explainer.